Thank you, Bob, Dr. Bob Gill, GP in Welling, and an NHS campaigner, as we all know you. Thank you for agreeing to come on and discuss what's happening with the NHS at the moment. It's a big national story. It's suddenly become of a major importance on all channels and media. I'd just like to play you a clip of an interview on GMB, Great Good Morning Britain, with Dr. Hilary Jones.
Let me read you this message. This is a group of doctors who share their sentiments and their feelings after doing their shifts. Never before have I sat crying in my car on the driveway at 3 a.m. after driving home from yet another catastrophic shift, where it feels like I'm unwillingly running the NHS Hunger Games of who will die first and how. And what this says to me is that the staff are incredibly distressed themselves about the situation. They're doing their best. But it's a bit like having 20 telephones that you need to answer at home and only being able to answer one at a time, each one with a life or death message on the end of it. So it's an impossible task they have, and they're very, very distressed about it.
Also, it suggests that A&E departments are no longer places where you can be guaranteed to get the best treatment, which will even save your life. It sounds like there is an acceptance now that the health treatment we are going to get right at the sharp end is simply about, I mean, from what that particular person is saying, you go there to die. I mean, that is horrific, Dr. Hilary. And for you as a health professional, where your first priority is to do no harm, and to make sure that you give people the best treatment you possibly can.
Absolutely. I believe that everything that we have come to expect from our NHS in the last 20, 30 years is no longer available.
Now, Dr. Bob, I couldn't help thinking that this has all come very suddenly, this crisis in the NHS. You've been talking about it for quite some years now. Why is this suddenly come to the front of the news, and what do you think about how we've got here? I mean, what have the medical community, what have the medical bodies been doing to stop it?
Yeah, thanks, Crispin. The clip you saw, what we're seeing is mainstream media is quite happy to cover how bad the NHS is, but what they're not very open about discussing is the root causes of the problem. Now, if the media were not complicit, the public would know that the NHS is being privatized by stealth, and a lot of the problems we are seeing are a direct result of successive government policy. And there are two big problems. We don't have enough beds for the size of the population, and we don't have enough medical staff. They're very two basic problems. But they never get explained. How did we end up with 100,000 staff vacancies in the NHS? Well, let's go back just a few years. I'll give you one example, the junior doctor strike in 2016, where they said, if you are going to worsen our contract, we're going to have people leaving the NHS. They predicted this. But what did the mainstream media do? They bent over backwards to paint the doctors as being greedy, or doing it, they're just in it for themselves. The reality was they knew that unless their terms and conditions are protected, the problems within the NHS, adequate staffing, safe staffing, being able to provide high quality care for patients will suffer. And that's exactly what has happened. Now, you mentioned, what are the professional bodies doing? Well, I'm afraid, you know, the professional bodies, the BMA, I know very intimately. We have a problem similar to what we see in the Labour Party, where you have a leadership totally disconnected from the membership's interests. And the junior doctor dispute I referred to in 2016 was actually sabotaged by our own union. What about the other health unions, the GMB, Unite, Unison? Well, none of them are spending any effort in explaining to their members, let alone the public, what's happened to the NHS. The NHS in the Beveridge model does not exist anymore. We've had successive legislation which has repurposed the NHS. So the NHS is fundamentally now a logo and a funding stream ready for corporations to move in and extract profit. And what they need to maximize the profit is a continued downward pressure on the wage bill. And that's what we're seeing playing out here. So, you know, I've experienced the damage to NHS services through the care of my patients, what they're receiving in my local hospitals. And we lost a A&E department, we lost a couple of hundred beds. Now, it doesn't take a genius to work out that's going to have pressure on the neighboring hospital. And that's exactly what happened.
Yeah. So it's all been heading this way. What do you think the agenda is for the government on this situation? Do you think they want to push for more privatization of the NHS, or how do you think they're coping with this situation?
Well, they know they have reliable allies in the media. They also have a complicit opposition party. There was always going to come a stage where the shit hits the fan. That's what we are seeing now. But because they can rely on the Labour Party and the media to play ball, they will present the failure of the NHS as a need for further privatization. They are weaponizing the preventable harm and death we're seeing up and down the country to suit their agenda. There will be no reconsideration. Maybe this avoidable tragedy and catastrophe is too high a price to pay. Not at all. They are ideologically committed to getting rid of universal comprehensive health care and shifting to a two-tier system, skid row publicly funded services and a top-up private insurance system. That's what they will do unless there is a public awakening and unless the unions pull their fingers out and start to explain to their staff and the public what the real agenda is. And to this day, I'm afraid none of the unions have done the job. They are still just talking in isolation about how hard up the staff are. Well, you need to connect that to safe patient care. You need to connect that to high quality service. You need to connect that to workforce retention, and you need to connect that to the agenda of privatization, which requires the wage bill to shrink.
Right. And as you say, the opposition isn't producing anything to counter the government's narrative in some ways on this, and in fact is embellishing the idea that privatization of the NHS is the way forward. I'll just play you a clip of Keir Starmer speaking yesterday.
Tony Blair looked to the private sector to help with that kind of efficiency saving. Do you think there's more scope for the private sector delivering public services? Have we reached the outer limits of it? Is it sometimes what works? Could there be a whole new development in that under your premiership?
Well, Gary, thank you for that question. The way I see it is this, that if a party wins an election and sets out its stall, its programme for change, it's then got to answer the question, well, how are you going to deliver that? And there are three basic models. One is you suck it all up to the centre and try to deliver it all through the state. I don't think that works, and we won't be doing that, to be clear. The other is to say, well, we've set out what we want to achieve, but it's the market that knows best, so we'll now leave it to the market. I don't believe in that model. I don't think that's worked either. And that's why what I'm proposing today, what we've put on the table, is a partnership model where with the an agile, active state working in partnership with private business, we deliver together, each clear about what their role is in that partnership. And that's the way in which we deliver for the future. But Gary, there's another part to your question which is really important as well, because I've obviously said we're not going to get the big checkbook out, but that is reform. Having run a public service for 5 years, I ran a public service in the criminal justice sector for 5 years. I've long been an advocate of reform, and we have to reform our public services, whether that's health or criminal justice, because the idea that simply putting more money in, which of course is needed and will bring about some improvement, won't transform our public services in the way that I think they need to deliver in the 21st century.
I liked his sort of rolled up shirt sleeve look that they all do when they're in a hospital or any clinical setting. Is that what you do, by the way? Do you always roll your sleeves up?
Only if I might be getting my hands dirty. As a GP, thankfully, it doesn't happen too often.
I mean, he's talking about it needs rejigging, reformatting. That the NHS needs reformatting. What does that actually mean in layman's terms, do you think?
Well, first of all, the question was a setup from Gary Gibbon, who's repeating a lie of private sector efficiency. There is no private sector efficiency. The private sector is interested in extracting profit. The private sector, when you involve them, it increases the administrative and bureaucratic costs. And the private sector look to avoid expensive, risky stuff. And when things go wrong, guess who picks up the pieces? The taxpayer, the public purse. The private sector hasn't delivered any efficiency in any public service that has been outsourced or privatized. What they deliver is less provision of service whilst they satisfy their shareholders and their CEO. So his question was based on a lie. The answer is Keir Starmer trying the old political trick of being in the middle. He said explicitly there, he doesn't believe in public provision of care. So he's an advocate of privatizing the NHS. And he says, I don't want to open it up to the market. Well, what has actually happened in July of this year was the legislation that has created the biggest public-private partnership reform that the NHS has ever seen. It's created 42 new business entities called integrated care systems, which is where public money, the control of it, and the provision of the care is going to be handed to private companies. So he is endorsing what the government have done. There is no difference between Keir Starmer's plan for the NHS and what the Conservatives are already doing. And he is signaling to the private sector, don't worry, boys, you're safe in my hands. You'll be able to fill your boots. What he also ignores is there is a long list of catastrophic public-private partnerships. Let me tell you about the main one that New Labour were responsible for, Private Finance Initiative, the building of hospitals and other public infrastructure using private debt. In the NHS, we borrowed 11 billion, we're going to pay back over 80 billion, and we won't own the hospitals after. That's what public-private partnership means. And alongside with the building of these PFI hospitals, we had the biggest bed closure program. Why is the NHS on its knees at the moment? Because we don't have enough beds. Why don't we have enough beds? Because of Blair's New Labour PFI scam, which was a method of transferring the ownership of our hospitals out of public hands into the private sector. Starmer and the Conservatives are ideologically aligned. They want to transfer wealth out of the taxpayer's pocket into private corporation and dress this up as some sort of reasonable outcome. He is fully committed to the death of the NHS. Let's not beat around the bush. And anybody within the Labour Party was still holding out hope that somehow, because he was in the Corbyn shadow cabinet and he made all these pledges, the mask is fully being ripped off. He is saying it for himself. He believes in the end of the NHS.
Right. I mean, the actual crisis in the NHS is a kind of blessing for those prescribed changes that he's talking about. So it sounds really dark to say it, but is that in a way what's going on, that they're really pointing up this crisis in order to give it a reformat?
Yeah, they will use any crisis to spin it to their own advantage. Look at the pandemic. A rational response to the pandemic would be a major reinvestment in public provision. What did we get? We got an outsourced catastrophe run by Serco and an accounting firm called Deloitte, which squandered 37 billion and failed to have an impact on the spread of the pandemic. That's what public-private partnership looks like. Go back a few years. We had the collapse of Carillion, whereby, you know, they were handed over massive contracts for public building projects. They collapsed and they left a £2 billion debt for the public to pick up.
Wow.
So all these people are doing is guaranteeing profits and guaranteeing a public bailout with very little risk. And when things go wrong, patients die, staff get exploited, staff get burnt out. This is a, you know, a cross-party economic catastrophe that they are engineering, and they're using the harm and the death and the traumatization of staff to push through their ideology, which will damage the country. It will waste money. It will increase the cost of providing healthcare. It will provide worse healthcare, and it will allow naked profiteering. This is madness. You know, if people on the left, political leaders on the left, well, they're not showing any leadership at the moment because all they are acting as sheepdogs for the Labour Party. The Labour Party under Keir Starmer is dead to anybody who believes in public services. And it's time we woke up collectively and said, this is not going to do. We need to challenge this because, you know, the worst thing that could happen is we have a Starmer government where the left, the socialists, go to sleep and hope for the best. We saw what happened under Blair. We had continued privatization. We had privatization of higher education. We had the Iraq war. We had no reversal of the Thatcher changes to trade union law and all the rest of it. We just saw, you know, more of the same. Exploitation of workers, downward pressure on salaries, more precarious nature of work, and a demonization of the working class. You know, when are we going to say it's time to give up on the Labour Party?